Well, good morning, and thank you for having me here, Liz, today. I've been asked to talk about the Connected Health Cities programme and the Northern Health Science Alliance, but I'm going to change tack slightly and change the title of my presentation, if you'll permit me, to how does $1 trillion sound? Well, on the day of the spending review, it sounds pretty good. And what on earth am I talking about? $1 trillion. That is the opportunity that exists at the moment by bringing together health data analytics, deep learning, connected devices, the electronic medical record in a way where we can start to shift from a care model, a 20th century care model of intervention to a model of prevention. And that's just in the US. The US is now reaching $4 trillion a year on healthcare spend. 70% of that at the moment is on intervention, with the remainder on prevention. That's meant to shift towards a 50-50 split. So this is a $1 trillion opportunity in healthcare. And the question I think we should be asking ourselves is, can we take a slice of that? Has the North got what it takes to take part in that opportunity? Well, in terms of health research, I think it does. Every year, the health research funders, whether it be government, medical research councils, people like the Wellcome Trust, all of the research that's conducted by those bodies is analysed based on the distribution across the UK. Last year, the North got £270 million of government spend for health research, and that's the third most in the UK after London and the South East. We were actually second to London in the number of awards, and we got 13% of the overall budget, which is a healthy start. But you only get to those sort of numbers when you start to combine the North at scale. So if you look at each of the individual regions, and here in this analysis they break it down into North, which is the North East, North West, and then Yorkshire and Humber, which I've highlighted in red, and then you compare it to London, we're far behind. But when you start to bring it together as the North, under that banner of the Northern Powerhouse, you start to see us positioning second to London. And then in terms of how that research funding is distributed, we're third behind London and the South East. So beating Scotland, Wales, and the rest of the UK. So that's health research funding. What about in the clinical trials? What about in the translation of that good research into clinical practice? Well, yes, we do have what it takes. The North performs 30% of the country's clinical trials, and two of the best performing trusts for recruiting patients are in the North, in Leeds and Newcastle. And it's not often you can actually draw a graph where the North is above London and Oxford and Cambridge combined when you look at the number of recruiting studies being performed by teams here in the North West, North East and Yorkshire and Humber. So we've got the basic and fundamental research, we've got the translational research in terms of taking that into practice through clinical trials. Do we have the business community to support that? Well, yes, again, there are over 1,000 businesses working in life sciences and health sciences in the north of England, employing 38,000 people and contributing over 10 billion to the UK economy. And that doesn't include the universities and the hospitals where a lot of that work and R&D is conducted. So if you want to look at the ABC, the academic, the business and the clinical, I think we've got it all. And that's why the Northern Health Science Alliance was formed. Liz mentioned we've been up and running for 2 years. The concept for the Alliance has actually been around for 4 years when a very entrepreneurial group of hospital chief executives, deans of medical schools from across the north, and the AHSN leadership came together to form a pan-regional alliance for health partnership. So we cover Lancaster, Liverpool, Manchester, Leeds, Sheffield, Newcastle, Durham and York. 8 teaching hospitals, 8 universities, 4 AHSNs, 15 million patients. That is a sizable health cluster to rival any cluster in the UK or internationally. So what do we do? Well, Liz has mentioned some of the things we do. We work to promote the north of England, and the irony is that whilst I run the Northern Health Science Alliance, I'm based in London and spend most of my time in London actually making sure that the messages about the good research that's being done in the north are heard centrally. We act as a bit of a front door for Northern Health Sciences research. working very closely with organisations like UK Trade and Investment, working with foreign companies who want to come into the UK, who historically take a flight in from the West Coast, arrive in Heathrow, do a tour of London, Oxford and Cambridge, get on a flight and fly back. We have to intervene and actually show them what we've got outside of that golden triangle, and that's what we do. We also work with the clusters in the north of England to maximise the impact of research that's already going on. Last week we brought the 4 clinical research networks that function across the north of England together with NIHR to look at how we can better work together on clinical trials. A couple of weeks before that we brought together the Cancer Research UK centres in Manchester, Newcastle and Leeds to look at how their learning can be shared between those centres. We provide an umbrella for organisations to come together and work together for the north. We work very closely with the private sector to bring in more R&D spend to our academic institutions, to our clinical institutions, and we work with the research funders to attract more research funding to the north of England. There have been some phenomenal examples in the past 3-4 years where institutions in the north that would have historically competed against one another came together to bid for funding and secured that funding. So Sheffield, Newcastle and Liverpool came together to bid for funding for the MRC and Arthritis Research UK Centre for Integrated Musculoskeletal Research. Historically they would have been bidding against each other. They came together and they won that, and they're now the National Centre for Musculoskeletal Ageing across those 3 centres. More recently we've been working with the NHSA members to bid for funding for the Innovate UK Precision Medicine Catapults. Through a combined bid we ended up getting 2 catapults, one in Leeds and one in Manchester. So we've been able to establish a functional health partnership across the north of England. We're being built as part of the UK's landscape. Recently, the Wellcome Trust and the Academy of Medical Sciences conducted analysis of the clusters that exist in the UK. The report mentioned Scotland, the Northern Health Science Alliance, and what was happening in the Golden Triangle. So there is a real recognition that what is being done here is being viewed nationally. As I said, sharing best practice across our partners, whether they be the research centres, translational centres, or working with businesses across the patch. And in the last 2 years, we've brought in £60 million worth of funding that wouldn't have come to the north without the NHSA's presence. So, back to the $1 trillion prize. How are we going to get our piece of it? Well, I think that's where Connected Health Cities comes in. That's where the learning integration of the business, academic and clinical communities can come together and start working on this tricky problem. So why have we come together to form Connected Health Cities? Well, as I don't need to tell this audience, the life expectancy and health inequality between north and south is quite stark. There is a life expectancy difference of 19 years between Bradford and Guildford. That's something that shouldn't be happening in an environment where we have a very active, research-active NHS. And the reason for this is not because of the quality of clinical care, it's not because companies aren't innovating and creating great new products to intervene early, it's the social determinants of health. And we need to start to look at health as something that interacts with all of the civic partners as well as the health and social care system, and that's where Connected Health City steps in. Our aim is to use that understanding and learning to tackle some of those big problems in lung cancer and liver cancer, in heart disease and COPD, where we do have an unequal burden of disease in the north of England. So how are we going to do that? Well, the idea is that we can bring together some of the great investments that have already been made across the north of England, bring them together under the AHSN footprints of the North West Coast, or the Innovation Agency I should say, Greater Manchester, North East and North Cumbria and the Yorkshire and Humber region. Drawing on those expertise from the MRC centres, SciTech Daresbury, North West eHealth and the FAR Institute, which is now spread across the north of England. And those highlighted in green are just some of the ones that are on your patch. So our solution is Connected Health Cities, a £20 million investment by the Chancellor, committed in the first budget back in March, reiterated in the previous budget and in the Tory party manifesto. So we've got hopefully a very strong leg to stand on with the spending review today. The idea is that we need to create the right environments to bring clinical leadership, academic leadership and business leadership together to integrate those data sets from the health, social care and civic components of our society to better understand how to deliver care. This is a project that has a real focus on clinical outcomes and clinical leadership. The aim is to have a number of arcs, safe havens where both physically and virtually we can bring the people, the processes and the data together to work collaboratively on those problems in the different regions. Bringing together companies, clinicians and academics, public health, statisticians, informaticians, social sciences, health economists, all together to tackle those problems which historically have been looked at in silos. We want to move what you see on the left, a dilute, duplicated data processing environment, to one where it's fully integrated, both with teams and the data being used together to tackle some of those health inequality challenges. And what's really interesting about this project is that it's not just being done in Liverpool or in Lancaster. It's being done across the north in a coordinated way. The teams are working incredibly well between each of the different regions. The therapy areas that each of the regions have chosen are quite discrete. And what we aim to do by having funding, not only to fund the projects in the regions, but we have funding to actually fund the learning and reuse of information from projects that are pioneered in Newcastle to deploy them in Lancaster, things that happen here in Liverpool to be deployed in Sheffield and Leeds. The thing that really then drives that is that this is not being top down. This is very much being driven by a bottom-up approach to this challenge. The aim of the 3-year project is to both start to identify some of these areas, bring those data sets together, but critically demonstrate that we can learn from those by sharing them across the north of England. We've already seen other clusters in the UK, in Scotland, wanting to build on what we're doing. Operations in the US, the 100 Cities project, have asked to reach out. Teams in the Netherlands and through the European Connected Health Alliance, there may be an opportunity to work with international partners to secure additional funding to scale that 20 million over the next few years. So far, we've got a number of areas that have been put forward by the different regions. These are being reviewed at the moment by an external independent panel. From the northwest coast, it's unplanned care and alcohol misuse. From the northeast and North Cumbria, it's frail elderly and long-term conditions and citizens with social deprivation, and then a number of other initiatives in the other regions. We'll be coming back to this group and to those in the regions over the next few weeks to be able to tell them exactly which projects have been selected and which projects will be funded. So to bring that together, that $1 trillion prize, we're working across 8 cities in the north, funded by both the research infrastructure that already exists in the region, but by a 20 million allocation from government. Working very closely both with the academe, business and clinical community, but critically working closely with the civic partners and government to tackle some of those big problems I mentioned earlier. 20 million over 3 years, over 4 city regions, isn't a lot of money. We're going to need to be able to demonstrate value, return on investment to the NHS, to Treasury in the near term so that we can go out and secure additional funding, whether it be from Europe or otherwise. And I hope that the teams in this room are able to engage with the businesses here to be able to build on that, scale it, and start to put some substantial infrastructure in the north to be able to help us claim that $1 trillion prize. Thank you.